My name is Dr. Michelle Gerber. I'm a naturopathic doctor and a licensed professional midwife. We're talking about yeast infections from a naturopathic perspective. We're talking about them vaginally. Yeast infections can happen in all over the place, and sometimes when you get a vaginal yeast infection, you may have yeast elsewhere, which I won't go into this in super detail, but if you're having chronic yeast or recurrent yeast, I almost always suggest that we test for yeast in other locations, especially in the intestinal tract, because you may just be continually repopulating the vaginal area with yeast from that location. So yeast can be present in lots of different places. A yeast is a fungal organism. When we talk about things that are infecting, we're usually talking about bacteria or viruses or funguses, and yeast is a fungus. It's a very microscopic one, so you're not going to see, like when we think about mushrooms or whatever, there's not going to be sort of large things that you can see, but what most people see is a change in the discharge. A very classic sort of yeast infection is white, curdy, kind of cottage cheesy discharge. That doesn't happen for everyone. It's just a kind of classic symptom. Most people will notice some kind of discharge change and some itching or irritation. That's a really classic sort of yeast infection symptom. When you have a yeast infection, there is an actual infective organism. There's something that has sort of come into the vaginal area and grown and populated the area. But in a sense, it is also still an imbalance. We all have yeast on us. It's, on our skin in different locations. It's just another one of those organisms that's supposed to be kept to a real minimum sort of state. And when we are out of balance in some way, then the yeast can proliferate and really grow in that area. So when we're talking about treating yeast, we're looking at getting rid of it, of course, but like most things from a naturopathic perspective, we really want to make the environment inhospitable to yeast, hospitable to the good bacteria that are really helping to protect us and keep that area healthy, and doing the internal lifestyle things to keep our immune system strong so that it's going to keep the yeast to a really minimum kind of state. With any vaginal infection, I always tell people you really do need to see someone to make sure what it really is. I'm a big proponent of, taking health into your own hands and doing things at home and making sure that because it's health is a partnership, and doctors can recommend things to you, but really ultimately you're the one that needs to be doing the things at home. So that's a huge piece of anything, but you really want to make sure that it really is a yeast infection before you go doing things, because there could be bacterial vaginosis, there could be another kind of infection, there could be strep, there could be trichomonas, lots of different things. So make sure that it really is yeast first. And then when I'm treating someone in the office, I'm usually giving them, like I almost always do, two categories of things. Something they're going to do lifestyle-wise, which of all the things that I've talked about here, yeast, more than any of them, is really sensitive to sugar. Sugar is something that makes our immune system not function as well, but it also really feeds yeast specifically. So really, when I'm talking about treating a yeast infection for the short period of time that we're really intensely treating it, I'm talking about no sugar, no white flour, even keeping things like fruit minimal usually for that short period of time. Even things that are genuinely helpful foods like fruit, their only calories is sugar. And so when we're trying to really starve out the yeast, I'm usually recommending that people restrict that as well for a short period of time. So there's the lifestyle things, getting rid of sugar, really repopulating the area with good bacteria. And then there's the things to really treat the yeast specifically. There are specific herbs that I will use. It kind of depends on how long they've had it, if they have it elsewhere in their body, or if we're just talking in the vaginal area. If we're just talking in the vaginal area, I may just do a suppository that's really directed against the yeast in the area that we're talking about. If they have yeast in other places, or they've had a really long infection or a recurrent infection, I'm probably going to treat them internally as well with specific anti-yeast herbs, because we want to make sure from sort of both angles that we're really getting rid of the yeast. And yeast can be kind of tenacious, so sometimes it requires doing things from both directions. I would definitely suggest that you discuss your treatment with some kind of a healthcare provider, because depending on if you're on any kind of other medications or you have other health conditions, herbs are wonderful healing medicines, but they are medicines and they can't interact with other things. But the things that really are typically useful are things like garlic, caprylic acid, grapefruit seed extract, Sometimes golden seal can be effective. It kind of depends. Usually when I see people, if it's not a really straightforward first time infection that we just did something simple and it cleared up right away, I'll do a culture on the yeast where they'll check and see what things from a conventional and a naturopathic perspective will actually kill it, like what herbs seem to be effective against this particular yeast, which can be really useful sometimes if you don't have a just sort of classic, standard, easy to heal yeast infection, which most of the time when people are coming to see me, it's one of those kind. Not easy, classic, just getting over it really fast. Otherwise, they're not always coming to the doctor for it. So I would test it to see what's going to be the most effective at killing it, but those are some of the most common herbs that we'll use against yeast. Most of the time when people have a vaginal yeast infection, it's called Candida because that's the species of yeast that tends to be infecting that, but not always, which is another good reason to have it checked, because if it's another kind, there may be another herb or vitamin that's more effective against killing it. Most people who are coming to see me and we're treating it from a naturopathic perspective, there's going to start to see relief in a matter of a couple of days, sometimes even less. But for it to be completely gone, I would say usually a week to 2 weeks. I always recommend that we continue treatment after the symptoms are gone. And if we're talking about a chronic yeast infection where they've got yeast internally, intestinally, things like that, it may be longer. But a classic sort of typical vaginal yeast infection, a week, maybe 2 weeks on the outside. Right now, from home for yeast infections, the first thing I would say is really, really, really cut out the sugar. That's a really powerful thing. Sometimes that's all you need to do if it's at the beginning stages of a yeast infection. Taking some kind of a probiotic. When you do probiotics, there are a lot of them out there that are really junk. And I get really specific about probiotics with women like brands and things like that. But in general, you want to get one that's refrigerated. You want to get one that has a high colony count. So when you look at the back, it's going to say a certain number of billions of organisms. You want to get something that's, I would suggest at least 20 billion, because some of them are going to die off in the process. So a good quality probiotic. And then another really simple thing that I tell women to do, especially if they feel like, oh, I'm kind of itchy, I think maybe I'm just starting to have an infection, is something called a vinegar sitz bath, which is where you just, you can do it in a bathtub. It's a little more effective if you have an actual sitz bath. That's something that you can pick up at any drugstore. It's just like a plastic, it looks like a bowl with a big wide rim on the outside. Women use it a lot of times after they've had babies to sit in to help the tissue heal afterwards. But it's nice because it's a very concentrated thing. It's just going to be the external area around the vagina and maybe a little bit internally. And what you do is you lift up the toilet seat, you set it on the toilet, you put 1 cup of white distilled cheapo, just buy it by the gallon full kind of white vinegar, and then you fill it up the rest of the way with just sort of neutral or warm water and sit in it for 10 to 15 minutes, at least once a day. If you have the time to do it twice a day, that's even better. And that can, if you have a really severe infection, it's not going to probably completely take care of it, but as part of a comprehensive plan, that can be really helpful at changing the pH to something that's not very hospitable to the yeast. And if it's at the very beginning of the infection, it's really effective at nipping it in the bud so that you don't develop something that you need more treatment for.